Hello everyone, this is Dr. Hunar. He's a PhD holder of Neuroscience from the University of Cambridge, and I'll allow him to introduce himself. IFMSA Kurdistan is part of the international team of IFMSA, and we have a medical education department, public health department, all the areas we can volunteer in, benefiting ourselves as medical students and the public. So this training is the branch of medical education. It's for students. Students get benefit, and we have other branches as well. Doctor, we have around 60. You can start your presentation now.
Okay. Again, thanks for having me. This is the second time, as I said, I am presenting for medical students. Hopefully, we both learn from each other. My style of presenting things is like somewhat relaxed. I don't follow the organization of introduction methods and then conclusion. I just start something like storytelling and usually start by talking about myself and why I am interested in artificial intelligence. So I will try to motivate you so that this topic, you will be interested in this topic as well. That's actually my main aim of this presentation. I didn't time my presentation and I prepared it in the last 2 hours. I put some slides, so I don't know how long it takes, but hopefully it doesn't take too much of your time. And if you have any questions that's related to one of the slides, you can interrupt me. Otherwise, you can postpone your questions until I end. To start, I would like to tell a bit about myself. My name is Hunar, and I have graduated from College of Medicine in 2009. Then, as most doctors, I did my rotation and a few years rotating in different hospitals, practicing medicine. My main interest was actually by that time was neurology. Neurology was the topic that I was really interested in, but the problem is I thought like neurology is too complex. There are so many puzzle pieces that we haven't figured out. And I that time decided to go back to the basics. I told myself I need to learn more about brain and how the brain works. And this topic was very thrilling for me. So then I did my master's degree in neuroscience at the University of Edinburgh. During my master's degree, most of my studies was about functional MRI and how to analyze brain pattern in aging groups. And we have published papers on how drugs like dopamine affects our memory. My PhD was about cognition and brain science at Cambridge University. Again, most of my studies was around how memory works, how our brain works. And right now I am the head of research department at the Ministry of Higher Education in KRG. And I still use most of my spare times to do my research on the brain. I'm mostly interested to learn how our brain works from a biological perspective, but I'm also interested how to model that inside the computers. I'm trying to learn more about how our neurons learn things and how human intelligence works and how we can recreate that in our computers. So we are trying to model what we have learned inside computers. So my path was a bit unconventional. So I started as a medical doctor dealing with brain science and then to become a neuroscientist, learning about the brain. And right now I'm trying to model the brain, trying to make artificial neural networks or learn from them. My background was from someone from a biological background to a computer science background. So right now I'm dealing with a very technical topic that requires knowledge from both biology and also computer science as well. So this is why I chose this topic, because I feel comfortable talking about this topic. Basically, artificial intelligence is an umbrella term. It's not well defined. When we talk about artificial intelligence, I am talking about anything that does something like our brain, but inside computers. So how we can make an artificial intelligence inside our computers? First, you need to know a programming language. A programming language is something that looks like English, but it's not like English. It's a concrete language when you put your instructions to a computer and the computer understands and execute that. So this is a simple example. Let's say you define some sentences like if fever in patient, then take paracetamol. If age is more than 80, take 2 tabs 3 times a day. For example, if vomiting in patient, if dehydrated, take antiemetics otherwise. So a lot of if statements. You give computer instructions like if something happened, do this thing in a concrete language. The difference between computer language and human knowledge is that in computers you have to define everything. Right now, this program doesn't work because I haven't defined what's fever. I mean, computer doesn't know what's fever, so I have to define fever as like high temperature. Even high temperature, computer doesn't understand. You have to tell them high temperature, anything that's more than 37, for example, because computers only understand numbers, and these numbers, they either come from the input when you as a patient type down this input, or from a sensor. So once you put these numbers or these instructions into the computer, so the programming language translates that into computer instruction, and then computer instruction execute that for you. So a program like that is like an artificial intelligence that can answer your question, that can answer your, so you give the computer your symptoms. This is a very, very simple example of something that we even right now doesn't say this is artificial intelligence, because this is actually my intelligence transferred to the computer. Computer doesn't know what to do. I am telling the computer what to do. So if anything I did wrong, if anything that the computer program did wrong, it's because I input the instructions in a wrong way. And that's why this is many scientists right now, this is they say this is an old-fashioned artificial intelligence. It's still used, but the intelligence doesn't come from the computer. It's you that you program the computers. We don't want that. We want the computers to learn from data directly. So let me give you a demo, a more detailed demo on something similar to that, that I have done 10 years ago when I was a junior doctor working at a burning hospital. When I was working in burning department, what I learned, I put the instructions inside the computer to make this program from. So I'm just showing you a demo of this program. So basically, when you open, hopefully, Dr. Venuar, you can see the program right now. Is that right?
Yes, we can see that.
Okay. So when I was there, there was on patient's file, there was a picture of a human figure, and you have to outline how, which areas burnt in this patient. For example, right leg, or this is left leg, and then hand. These areas which are marking it. We used pencil to do that. And then there was a big table using the rule of 9. Rule of 9 is how you calculate the body surface area. And you will probably study that in surgery. You use this table to calculate how much area is burned. So right now, this program actually tells me that 25% of this patient is burned. It automatically calculated that. And if you put some instructions, let's say, I'm just putting some random instructions here. Okay, so fluid calculation, it calculates everything for you automatically. And then let's say computers not, if you push that, it will generate a paragraph for you based on the information that I put here. Like Ali is 44 years old male living in Hawler, burned by hot water at that date, and then his total body surface area of the burn is. So it just feels for you, and then it even gives you the lines of management, like what you should do. You should give this patient IV fluid, because in the program I told how much area if burned it needs IV fluid, painkillers, and then Foley's catheter. That's because the groin area is also marked as being burned. So if I burn the face area as well, it will probably tell me that I should also need to give oxygen. So the program is already somewhat intelligent, like depending on which area is burned, the program tells the computer it tells me what to do, which lines. So this will be useful for you to forget, not to forget. I mean, sometimes there are too many variables in your brain. You are stressed and you forget. So such program can help you a lot. Unfortunately, by the time I finished building this program, my time was up. So I didn't use that for myself. My plan was to improve the program more because there are still some flaws in the program. But unfortunately, because I went to study abroad, I couldn't finish that work. But this is just to tell you that even knowing a little bit about computers, it can help you to achieve a lot of things in medicine. The problem here, many of us doctors who work in the medical world, we don't know programming languages. We don't know how computers work. I mean, computers is a world by themselves. You give them instructions and they execute the instructions for you. We don't know about that. And people from the computer science field, they know how to build programs, but they don't know what are the problems that we doctors deal with every day. So bridging that and connecting these two fields is actually important. And I am hoping that as someone who have been in both fields, I should do something about that. So if I show you the code of this program, actually the code of this program is available online. I have defined a lot of variables, like so a lot of if statements, like if phase is burned, what should the program do? So a lot of instructions, just I told you, and then the computer executes these instructions for me. The problem with this type of artificial intelligence, as I said, it's like we are giving the instructions to the computer. The computer doesn't learn by itself. Humans doesn't work like that. We humans learn from our mistakes. So our approach is a bottom-up approach. So we don't know anything, and then the approach which I showed you right now is a top-down approach. I say to the computer what to do. But the bottom-up approach is to learn from your mistakes. You don't know anything and then mistakes. That's how we humans work. For example, when a child learns to walk, you don't program these instructions to the child's brain. You don't tell the child, oh, if you are up, then you need to move your leg 5 degrees. If your your leg touched the ground, you need to move the other leg another 5. So you don't program these statements into the mind of the child. The child sees grown-ups how they walk, and he tries to do that. He learns from the majority of the learning happens by trial and error, and this is how our brain works. Imagine that you want to go up a hill. Then the path that you take to reach to the top of the hill is your learning process. But once you get to the top, then you will become just like your teacher. Your teacher is someone who is at the top of the local maxima, which actually gives you the instruction, or you learn from your teacher. Maybe you are a doctor and your teacher is another doctor who deals with the patient, and you watch how your supervisor deals with patients, and then you learn from that. So once you learn to do to become competent enough, just like your supervisor, it means that you have reached the top of the local maxima, the maxima that your teacher is on top of that. Basically, that's not what we want. We want to move even beyond our teachers, but that's a topic for another. This is a very complicated topic. I can't talk about how to do that. But right now, the learning process is how do we reach local maxima, or how we learn from our mistakes. And the way that our brain does that is due to the plasticity that we have in our brains. So let me give you an example of how plasticity works. Basically, our brain try to minimize the errors. We try to predict stuff because predicting stuff is important for our survival. So if I press this button, this light bulb turns on. So your brain tries to make a connection with that. It tells me, okay, this button is related to this light bulb. If I press this button and this light bulb turns on, your brain makes a connection with this. So inside your brain, these connections, you do have neurons that can recognize buttons, and you do have neurons that can recognize light bulbs, but you do not have a connection yet, because this connection will if it's made, it makes a causal model inside your brain where next time when I press the button and the corresponding light bulb will turn on. The problem is that our brain still is limited. So if I press this button and this light bulb turns on in 3 days, then if I press this button, the other light bulb turns on in 2 days. Then if I press these buttons in random intervals, your brain have a much harder time to recognize which button related to which light bulb. So all I am saying that our brain is can easily make connections between things that happen together. But if two things happen in a long distance, if there is too long distance between these two things, the event and the effect, your brain have a much harder time to make the connection because there are a lot of noise around, which is market the noise here as red signals, red circle. Our brain is comprised of many neurons, like 100 billion neurons inside our brain, and you know about the neurons from your physiology, specialized type of cells that can send electrical signals to each other. Interestingly, that all parts of our brain, occipital region, frontal region, everywhere is same. It's just a large number of neurons interconnected. Even the one that's connected to our vision is actually similar to the one that's connected to our hearing process. It's just like all the signals, the sound signal, the visual signal, all types of the signal, they will be translated by your eyes or your ear to electrical signals. And then when it gets to your brain, it's the same algorithm that works everywhere. It's the same type of plasticity. There are many ways how neurons make connections with each other. If you remember from your physiology, spike time dependent plasticity you have Hebbian learning, you have long-term potentiation, short-term. So lots of topics that you can review that. The point here is how we can recreate that inside our computers. Recreating that is not that difficult, to be quite honest. You know that from, if you are a gamer, you know that people can create an entire world inside the computers. All you need is you gave the computer right instructions. So we actually, with my brother, made this video about graphical video about how neurons works inside our brain. This was a brief visual view. To make your computer work, you don't need to visualize that. So even this is just a pretty picture, but your computer will, all you need is to give the instructions to your computer so that your computer can create virtual neurons, and these virtual neurons does something similar to our real neurons, like sending signals. To model that, you don't need to recreate everything. So I haven't created the sodium channels, because if I do that, if I create every single bit, the computer can't handle all these information. The storage of the computer is not enough to compute all these, but you don't need that. All you need is to recreate the basic functionality, which is that your neurons fire electrical signals to each other, and then these electrical signals spread across all the neurons surrounding it, and depending on which connection is stronger, the information pass through other neurons. So basically, you have an artificial neural network. The thickness of these connections, like connections that are thicker, it means that these two neurons are more connected. The connections that are thinner, it means that these neurons are less connected. So basically what you want, if you want to give an input to your computer, and then you want to have an output, a desired output. If your output matches your target, that's good. That means the connections in this network is really good. It makes the desirable output for you. If your output doesn't match the targets, there is an error. You have made a mistake. And then what you do is you penalize some of these connections. So I would say, oh, this connection is thick. Probably the error happened because these two neurons are strongly connected. So I need to make this connection weaker. The next time you make this thick connection weaker. This is how plasticity works. You make some connections stronger, you make some connections weaker, depending on the output. So let me give you another example on this type of program. This is a type of program where I wrote that using a neural network. So let me show you this demo. In this example, I made a network. So you can see here there are 4 neurons. I didn't translate that to English. I was about to translate that, but then the time come up. So I made this program for another speaking to another Kurdish audience, but you understand that. So this program is a fun program just to understand how a network works. So I made 4 neurons, which represents 4 inputs. The 4 inputs is service years, grades, and then whether you have nepotism or your gender. So based on that, let's say the person 1 have 7 years service and then have grade 9 of 10, and then doesn't have any, he can't pull any strings, and then he's male. So should we accept this person? I would say yes, let's accept that. He has a lot of service, good grade, that's cool. Then now person 2 doesn't have too much service years, and then his grade is not good, but he can pull a lot of strings. I mean, let's say we are good managers. We do not accept that. This person will not be accepted by our standard. This person is like half and half. Let's accept that as well. This person also have a lot of nepotism, but doesn't have any grades. Let's not accept that either. Let's accept 3 persons. So I have accepted 3 people. Now, what I am going to tell this computer to learn from my pattern. I am a manager, I am a teacher, and this network, this artificial brain, which you see that, which is only 4 neurons, I tell that to learn from the pattern, learn from me. So when I push this button, now the network learns. The network learns. What it learns, it makes some connections stronger, and it made some connections weaker. I don't know how it made that, but ignore this visual picture. The visual is there just for fun, but the important part is you can see it gave a negative weight to nepotism. The network, the artificial network, understood that I usually do not see nepotism as something good in a person. If somebody comes to me, if I am a CEO of a company, I usually don't give too much weight to that person. But then it understood that I'm giving a lot of weight to grades. So let's clear that, and let's make this time our network to decide for us whether it takes this person or not. So let's push this button. Okay. So according to the network's decision, person 1 and person 2 accepted, which is correct from my standard, but the network still have to learn, because I also accepted this person as well, but probably the network didn't learn completely. So I have to make a lot of training for the network to see me many times, not only one time. I hope that this example gives you the picture of how neural networks work inside the computer. So basically you have an artificial network. I haven't written any if statements to tell them, oh, if somebody have good grades, accept it, if not. So I haven't give any of these instructions. I just gave the computer the data and my decision, and told the computer, based on my decision, learn the pattern. And then the computer learned the pattern. It gave some weights to what I appreciate. It finds that by itself using the algorithm which I have written in the form of a neural network. And that neural network learns from its output. So that's the code, actually. That's in the instruction that I give to this computer. As you can see, the code, the majority of the code, actually, I haven't shown it, which to produce buttons and stuff like that. But the logic, the brain, is actually just this loop, which you can see a E letter. E letter is demarcated for error. So the error compares between the output and the desired output and the current output. And then this loop learns from me. As you can see in this code, there is no any if statements. I haven't told the computer if somebody have high grades, accepted, if not like the burning program which I showed you in the beginning. So this program is actual machine learning. This is learning from errors. I just made a generic neural network using some lines of code and some equations that are modeling our plasticity, the way that our brain works, because our brain is also works like that. I make a mistake and then the connections inside my brain modifies itself so that next time I predict something correctly. And as you can see, it worked. These types of networks can give you any output. So this program, you can imagine how can you use such a program in medicine. We can change these to like symptoms, let's say service years, fever, headache. So you can change these, and then the decision is actually you can change that to a disease, whether the patient or to prognosis, whether the patient dies or lives. So when you collect these data, you give the computer will learn the pattern. It will learn which is important and which feature is important and which feature is not important. So this is an example of that you can translate such a simple program to help you in medicine. I haven't done that yet because this program is too simple. It is just made for this presentation to make this clear for you. But usually we do have a lot of more complex programs that have many neurons and they're much more accurately. And then you can make these neurons to detect faces. So the same of this program, you can give pixels or images, and then it can predict for you whether this is an image of cat or this is, if you give it chest x-rays, it can tell you whether this chest x-ray is diseased or not, whether a patient have pneumonia or not. So it's the same thing that can reuse it for any purpose that you like. You can reuse it to detect faces. As you can see, Facebook, every program right now, it uses this feature. And this is a neural network inside your mobile or inside the Facebook, which recognize faces. It has been trained to recognize faces, just like I trained my program to accept some people and reject other people. You can train these networks to predict the next word for you based on the previous words. So Google works like that. So if you give some sentence, and it predicts the next sentence for you. In fact, I have made another program. It's still in beta. And I'm still working to improve it, which is right now is not really good because it can't model long-term dependencies. But when it's good, researchers can use it. So I have trained this program to read this book for me. The book was available freely online. So I gave the book to the program, and the program learned to connect two words for me. So right now I give cancer and diabetes to this program, and I told them to give me some sentences that have the word cancer and the word diabetes. So I wanted the computer to connect for me these two words. So these are the sentences that has been generated for me by the program. And these sentences doesn't exist inside the textbook that has been trained on. The program tries to make new words to predict and to link these words into a meaningful sentence. So right now, it doesn't make too much sense because the data that I give to this program is too limited. Basically, I don't have big computers and a lot of data, but if I have, I could give a lot of data to this to make it more intelligent and to give me sentences that can relate between various words. And this will be very useful, in my opinion, for researchers, because sometimes you want to brainstorm, you want to link between different words. So my program is, I'm still working on it. It's still not finished, but there are another program, which is, people call it GPT-3. GPT-3 is a very big program that can generate text. It has read nearly all the internet. It has read all the Wikipedia. It has memorized everything. So right now, if you give a sentence to GPT-3, it can finish that for you. So let me show you this demo. So the GPT-3 is available online. So right now, let me say the causes of heart disease are, and then I'll push generate. Then it will try. Are compared that some people are genetically, so it will try to connect for you. And interesting thing is this sentence doesn't exist in the internet. The AI, the artificial intelligence, generated that for you. Basically, you can use that in your work. But it's not 100% accurate. Sometimes it gives you false information. But it's really, really interesting. Like this GPT-3 is really interesting. I have been actually using that to diagnose some cases, not in real life, but just to test the program. For example, one of the friends on Facebook posted this question. So a 26-year-old man presented to the primary care physician with penile discharge. He also reports experience pain with urination starting 3 days ago. Last weekend, he engaged in unprotected sexual intercourse with a new female partner. His vital signs was around then all these information and gave this. So I tried to test GPT-3 to see if GPT-3 can actually give me the correct diagnosis. So that was the GPT's answer. So the answer that GPT-3 gave me, so I just copied and pasted this instruction to GPT-3 and I pushed generate button so that the GPT-3 generate the answer for me. So the text in bold is the text that I gave to GPT-3. And even then, as you can see, the answer is I gave it to GPT-3. I wanted GPT-3 to complete that for me. So the text that's not in bold is the one that GPT-3 produced for me. So GPT-3 said the answer is B, positive leukocyte esterase and positive nitrate. And then it gives me some instruction of why it thinks it's B. So it says that the patient has symptoms of urethritis, which is the inflammation of urethra, and then etc. So what was the real answer? The real answer, I followed that Facebook post. So the real answer is actually A. But interestingly, the description is actually very similar. So again, it's urethritis, refers to inflammation of urethra. So it's the same answer. The problem is that GPT-3 actually gave the correct answer, but it gives the wrong letter. So that means that GPT-3 is not useful for your exams because it gives you the wrong letter, but it's still useful for the patient because it gives the right diagnosis. It just doesn't give the right letter. Maybe this will be improved with GPT-4, 5, or we are trying, and even my program, I am trying to make it more correct. But right now we are still working on it. But this is, keep your eye on this. This is the part there where artificial intelligence can be really, really helpful. And then just for fun, I just tried to make GPT-3 to make relations for me between lymphoma and myocardial infarction and renal stones are all related, because so the text that's in bold is the instruction that I gave to GPT-3, and the one that's not in bold is the GPT's completion. So they are all the result of a state of chronic inflammation, which makes sense actually. And this is another example. So GPT-3 is not deterministic. So if you delete your query and if you try again, it can give you a different answer each time. So this time it says they share the common trait of increased level of uric acid in the blood, which is again correct. I Googled that and I realized that indeed you can think of uric acid as a common related factor between all these different topics. But it sometimes make really, really silly mistakes. So this example someone gave me, and I want to, this is a very sophisticated, specific example that GPT-3 probably haven't read too much books on it. So it can make mistakes. So they say that pre-papillary choroid and myocardial infarction are related because of the presence of a common vascular supply, which is interesting because you can say everything in our body is related because there is a common vascular supply. But here it says that posterior ciliary are branches of internal carotid artery, which is the major source of blood supply for the myocardium. We know that internal carotid artery is here and it's not a major source of for the myocardium. So it makes these silly mistakes. So as a doctor, you cannot depend on GPT-3 100%, but it's still useful for brainstorming. For example, if somebody tells me pericapillary choroid and myocardial infarction are related because I will be just stopped. I don't know how they are related. Maybe at that moment, it doesn't come to my mind that they may have a common blood supply. So something like GPT-3 is actually brainstorms for you. It can help you to give the correct answer. So finally, I have given you some examples of how artificial intelligence works and how it can be used in medicine. And there are many other examples that, so if you type down deep learning, so currently deep learning is the state of art of artificial intelligence. If you type down deep learning and chest x-rays, deep learning and dermatological disease, you'll see that many people are actually using these tools, their artificial tools, to, for example, diagnose chest x-rays, and in some cases the accuracy is quite high, even skin disease. So you can Google that, deep learning and stuff, or artificial intelligence and stuff, and you will see a lot of examples of how people right now using artificial intelligence in medicine. I will just try to tell you why artificial intelligence is important. I mean, why we need to depend on it. One problem is that our working memory is limited. We can't remember everything because even if we want to learn a lot of things, we have to use our long-term memory, and long-term memory is, you need to study a lot, and you know that in medicine is something very multifactorial. So many factors are related to each other at cellular level, at micro molecular level, so everything is related, and there are so many factors that if you understand a simple disease, you have to understand so many variables that is impossible for our brain to learn everything. You can't become pediatrician, clinician, oncologist. You can learn everything in the world to understand a disease. Right now there are many diseases like cancer, COVID, a lot of stuff that we are suffering from, and we can't find easy solutions to it, mostly because our brain is limited and our knowledge is limited. So to learn everything is just, our age doesn't depend. So by the time when we try to learn everything, we will just die. It's like if our age is 1,000 years ago, if our age lifespan is 1,000 years, then I can use this age to learn maybe anything, programming language, and I can go back to College of Engineering, learn some mechanical engineering, learn a lot of things. So as you learn a lot of things, you will be able to invent more important things. But our age is limited. So by the time we learn stuff around us, we will just die, and that means that we can't really cover all the subjects. So to cover, to be specialized, you need to be specialized to make something useful. And that's why most of us actually start broadly in their life and then try to learn the stuff that relate. By the time it ages, it can invent new things, make new links in the life. But the problem of specialization, specializations have helped us. Without specialization, we wouldn't be doctors because we can't learn everything. But the problem with specialization is that we will be trapped at a local maxima. It just means that, so I have a detailed video about local maxima. If anybody interested in it, that can watch it. I see that local maxima is a very, very interesting topic in mathematics and in life as general, but many of us are not aware of it. So local maxima is where you strap on, and your change will become very, very difficult, simply because you have been specialized. This sort of specialization doesn't let you to make long-term dependencies, because you haven't learned anything on this part. And this means that you can't make connections. So as a doctor, you can become a great doctor, but you can't invent new things, because maybe treating some cancer requires you to invent a mechanical device that requires engineering skills. But because you are a doctor, you don't know anything about engineering, so you can't do that. So that's what I mean by local maxima. We will be just trapped on what we learn, and we can't invent new things. And that's why I think AI can help us. AI can help us to to superpose that, and because it can be just a tool for us to learn the basic stuff for us, so that we have more time to learn the stuff that matters. And that's my hopefully you enjoyed that. If you have any questions about AI, I'm here for you. I don't know how this works. If
Dr. I think he meant if anyone has any questions, they can raise their hand.
Okay, yes, sure.
First, we have
Hello.
Jamil. Yeah, go on.
Hello, Doctor. Thanks for your nice presentation.
Thank you.
Dr. Hunar, I just wanted to ask that in your idea that if in next like 20, 50 years, I don't know, that AI that becomes so intelligent that it can cover like what doctors do, especially the not the physical jobs of doctors, like mostly the diagnostic jobs that specialist doctors do. What will be the role of doctors? Do you think that we will need less doctors per person, for example, and their role will be like minimal jobs, or they will still have their significance in like society?
Yes. Yeah. So this is a common question that many people think that once AI become too advanced, many jobs will get lost, and this is the reason why I don't agree to that. Think agriculture. Agriculture before, like 1,000 years ago, probably 50% of our population were they were farmers. But right now we don't have farmers. Does that mean we lost our jobs? No. Only 1% right now, to my knowledge, that they work as farmers, and this 1% is actually enough to provide food for most of the world. Basically, the limitation is financial, not because we have too few farmers. The point is that people can adapt to the changes. So right now you do have many new jobs. You do have YouTubers. This thing was unheard of like 20 years ago, but right now you do have a lot of new jobs that unheard of. So the point is the same for artificial intelligence. If it becomes too intelligent, that doesn't mean doctors will lose their job. It's just like you will be adapted. You will become someone who uses AI in your favor. So right now, when you graduate, you will become a junior doctor, and junior doctors are, you just take some information, history taking from the patient, what's your name, what's your age, so a lot of things that can be automated by the AI. So as a doctor, you don't have to do that. What you have to do that if an AI inside, let's say, a computer program inside our mobiles, if the patient was in the home, it records some data, like inputting some data to the AI, saying like describing her or his symptoms to the AI, and then the AI can summarize that and then send that to the doctor, and then the doctor can use that as a help, not depending on that. Because we can't trust AI. There should be always a human element in it. And the human element is just a security measure. And that, I mean, as a doctor, your job will be transferred to someone that you don't have to do a lot of routine, repeated things like taking detailed history. What you need to do is to introduce yourself to the patient, ask important questions, because you know the patient's history. You don't need to ask again, what's your age? What's your, how many alcohol do you drink a day? How many? So you don't need to ask that, because you have all the data of the patient is summarized for you. Now you come to the patient, you introduce yourself, you introduce the patient just to communicate, to give the comfort to the patient. And then you ask targeted questions to the patient. So what you will be doing right then, you will be acting as a senior doctor, not as a junior doctor. So right now you are collecting the data, the detailed history, and then you present that to your senior doctor, and then your senior doctor thinks about the diagnosis. But then the AI will do this repeated job for you. And then you will be doing the senior doctor job. And then what your senior does, your senior also doesn't become jobless. Your senior maybe now has more time to do research about like how diseases are related, or can deal with more abstract things that are higher level stuff.
But Doctor, AI will do that too. They will do the research.
Well, it will shift. It will shift. So maybe in the next 10 years, the AI will become so intelligent, it will do the senior job as well. Now, we will do, as a junior doctor, we will have to do the research part. So the jobs will be shifted. It will not, it just means that, are we able to adapt ourselves to this fast change? I don't know. The adapting part is probably something risky. Maybe the AI will become too soon, too intelligent, that we haven't even adapted to that. And that's why this presentation is important. I am telling you right now, okay, there is a field that's advancing very fast, and you as a medical student, maybe you are not aware of that. I mean, as someone who has on a laptop, I just made a program to accept for me, like to behave like a manager. So something like a Microsoft, a lot of engineers right now, they are working on making artificial intelligence. These artificial intelligence reading thousands of books, Davidson, Hutchinson, every son books. And then we are just sitting right there, don't knowing about AI. That's why I'm telling you this topic is important. If we do not adapt ourselves to it, we will be in danger. Because so the problem is not that we will lose our job. Can we adapt to these fast changes? So hopefully you will now think more about like the value of the AI, so that you can prepare yourself for what's coming in the future.
Yeah, thank you for your clarification.
Not at all. Thanks for the question.
Any more questions? Characterotherapist, do you know more questions? Thank you for your time. I really appreciate your time. And hopefully we'll have an on-ground project about the same subject or similar subject. Again, thank you all for coming.
Thanks a lot for everybody.